like to ask your permission to use this video for educational purpose and on the internet.
Yes.
Tell me about the surgery. When did you get that surgery on the bottom of your spine?
2009.
2009.
March, September or March.
Yeah, if it is still
6 months later, I
2009.
had a hardware removal
Yeah,
because I was still
yeah.
having issues. But I went in, and my surgery was supposed to be, I think he said 2 to 3 hours.
Okay.
And so as time went past, my husband was in the waiting room and was wondering what was,
Yeah.
and it turned out I was in there for 5 hours.
Yeah. How long did you stay in the hospital?
I was in the hospital for, I think it was 5 days,
Mhm.
4 or 5 days.
After the surgery, when did you start walking?
I did not start walking until the next day.
Next day.
And that was just,
Barely walking.
they put the leg cuffs on, so
Yeah, yeah.
and I had a catheter in, and so it was the next day, and that was with help. And I stayed in because they had to show me how to
Yeah.
get out of bed, to move. It was a 7-8 week recovery.
Yeah, yeah.
Yeah, I was out. I
8
was
week
working at
recovery.
the time. I'm on disability now, but I was working, and I was out of work for.
Yeah. Now, do you remember that as well?
Yes, I do.
How
I
long
was the
after?
nurse.
Yeah. How long after the surgery could she do the basic daily stuff at home? How long did it take her?
Oh, long time.
Long time.
He put a bed in our
Yeah.
living room.
Yeah.
It's a bed in the living room. She needed to be assisted to pretty much everything
Yeah.
for months.
Yeah,
Months.
so I was with the
Yeah.
walker and
So what you got is a one-level fusion, or what we call TLIF. That surgery is still being performed by most of my colleagues. So that's not the unusual. What you describe is actually average. The average time for open surgery is somewhere between 2.5 to 4.5 hours. The average hospital stay is still average hospital stay in
Okay.
this town is 4.5 days for that surgery, and recovery 3 to 6 months. Now,
Yeah, it was
when
months.
it's
A long time.
still that surgery in 2009 is still being performed with the same results.
wow.
Now, so when I tell my patient and my colleagues actually that we do and you got a one-level fusion, we do a one-level fusion in 35 to 40 minutes, and my patient walk within 1 to 2 hours, and they usually ambulate in that time frame. Most of them after one-level fusion, they go home same day. In your age group.
That's
And
amazing.
Yeah.
No,
yeah.
I was, a lot younger then, but.
Yeah, even but it's still.
Yeah.
And
yes.
obviously surgery is never a walk in a park or piece of cake, but we have got a long way, and it has happened to me 5 times so far in the last few years that I'm done with the surgery. I go and talk to the loved one and the family, and they are totally shocked if they had a previous surgery. They think it's something wrong because I'm out talking to them so soon. So they think it's actually, I have to calm them down and say, no, nothing is wrong. It's just different kind of surgery. Now, it's not that we are trying to speed that up. It's just a different kind of surgery that makes it faster. Like I was using the analogy of driving from here to Chicago or flying from here to Chicago. It's just a different mode of surgery that makes it more efficient.
Correct.
And but we know that for sure. That's not a question.
Well, and I believe that's why Dr. Crocker
Yeah.
referred me to you, because he was going to do an L4 fusion.
Yeah.
It actually, how many years ago before I came here, it was denied, and he ended up doing a laminectomy, which
Yeah.
is not effective, but he then referred me to you.
Yeah. Now we know from lots of data, people don't recover the same from a surgery that's half an hour versus 5 hours. It's just that they have different recovery and risk profile. So I think that is what we are doing different. We made the surgery so efficient, so the low risk, that people just recover from that faster. And it's not only, you were surprised positively, I'm hoping, surprised about how efficient this OLLIF procedure is. But my colleagues
Oh,
are the
yeah.
same way. Many of my colleagues have a difficulty to wrap their head around. But it's no other thing than we just have to train more.
And that recovery in the hospital was just,
Yeah.
it was was awful.
Yeah.
It was
Yeah.
a hard, very painful.
And it is.
And I know that there's still pain involved. It was
Yeah.
at that time. It was just.
Spine is miserable. We know about that. And more you damage while you're getting the job done, it's going to be more miserable afterward. Well, I thank you for sharing your
You're
experience
welcome.
with us. Okay, thank you. I appreciate that.